Hi everyone, my name's Tyler Martin and I'm the CEO of Quill AI. I'm an integrated product design master's student at the University of Pennsylvania. I'm honored to be joined by my incredibly brilliant co-founders, Hoyt Gong and Lauren Mead. Hoyt is a life sciences and management undergrad student at Wharton, and Lauren is a third-year med student. Over the past few months, we've spent countless hours interviewing doctors, patients, and administrators at hospital systems trying to figure out what works and what doesn't work with EMR systems. And big surprise, doctors really don't like interacting with EMR systems. It's our mission to fix that problem. This all started about 9 months ago, and I was chatting with my best friend, Will, who's a cardiologist. Will was so frustrated at the amount of time he spent looking for lab results in the EMR system while his patient sat next to him waiting for a reply. Will's trying to connect with his patient, but he's stuck interacting with this EMR system.
And so typical encounter begins for Will by coming into the room. He completes a physical and a history. He then comes up with a therapeutic and diagnostic plan and leaves the room. Afterwards, somebody like Will working in an outpatient setting may see as many as 30 or 60 additional patients. And before Will goes home that day, he needs to complete and review notes for all of those patients.
And in that process, Will has several points of friction. For one, he's unable to look into the EMR and find data like lab values while still talking to that patient. Second, EMRs were made for billing purposes. Doctors aren't trained nor incentivized to bill to the maximum extent, leaving value on the table. Lastly, doctors spend upwards of 2 to 3 hours per shift just charting notes, leading to high burnout rates and inaccurate documentation.
So how do we solve this problem, and how does Quill work? At a high level, Quill is an interface between a physician and an EMR system. That breaks down into a couple of pieces. Number one, it's a smartphone app that is passively listening to a patient conversation, sending information back to an EMR, to our Quill system. While we're doing that, we're looking for key contextual clues in those sentences that the provider is saying to the physician. To do that, we are able to bring forward some very real-time important data so that the physician can make decisions. So for example, if Lauren's my physician and he's asking me about my hypertension medications, Quill will be asking the EMR system, hey, can I get all of those blood pressure readings? Quill will visualize that entire history. It will plot on the chart when various medications were given so that the physician can really provide decisions without spending time looking through the EMR. And finally, because we have all this textual information of the conversation, Quill writes a physician's note for the physician. Using a combination of machine learning techniques and human scribes to increase accuracy, we will prepare notes in a way that are accurate and timely for the physician.
We have two main sources of revenue for Quill, one speaking to the power of transcription and clinical documentation improvement, and one to our data play. In order to cover overhead costs, we serve our remote medical transcription with an annual base fee dependent on the size and scale of our EMR clients. We charge $10K a year per physician, comparable with existing competitors, and even cheaper than some of the current technologies. On the back end, our data that we collect from our transcription services poses value as well. We're able to store this in an anonymized, queryable database, in which then we can license out to, say, contractors, like scientists or clinicians, to do these quality improvement and clinical research studies. And the time is ripe right now. The global medical transcription market sits over $53 billion in 2017 and is projected to grow even more. This, along with the tripling rate of the clinical data analytics market, makes this a perfect opportunity. We plan on starting in the US outpatient services, which has been spending high growth in the information technology spending. And on our competitors, we've done our research and segmented them into 3 main components. On the left is the competitors with no AI technology, using mainly speech-to-text dictation practices. In the middle, we have the AI solutions, which fall short in their inaccurate abilities to, say, rely on only an algorithm, and fall short in their capabilities to actually process data. The only real direct competitor we have is Augmetics, which also uses a human plus AI hybrid. However, we believe that a real-time search robust model serves to play down the road with that data. And really speaking to our competitive advantage, that goes back to our human-in-the-loop model. Using the supervised learning technique, we're combining the best of both worlds with human medical transcription and intelligent automated transcription. This process of human-in-the-loop allows us to learn from existing past notes and train to even higher accuracies like never before. This, coupled with our real-time search, poses as our competitive advantages.
And so to make this vision a reality, Tyler's brought together a uniquely suited team with a combination of technical, business, and clinical experience. Tyler himself is already an accomplished entrepreneur with several consulting businesses to his name, for which he's leveraged past work experiences as a consultant at Deloitte and also building search technologies for U.S. intelligence agencies. My friend Hoyt here is an accomplished clinical researcher and has an understanding of business development that he's garnered from the #1 undergraduate business school in the country. And I add a clinical perspective along with some lessons I've learned in launching a clinical decision support tool and in piloting a mobile health app for Penn Medicine employees. In order to fill gaps in our knowledge and also to open doors in the healthcare industry, we've gathered some mentors across our campus in notable institutions such as the Center for Healthcare Innovation, Wharton's Entrepreneurship Community, VIPC, and finally the Integrated Program for Design. And so as part of our next steps, we're going to be launching a small pilot in an outpatient setting where we'll be testing and validating our HIPAA compliant service before we expand direct sales and capture market share. And we've already made great strides. First, we've done extensive interviewing of physician end users. We've also built an MVP, and we've secured support in the form of grants and in-kind awards. And so next for us, we'll be building out our product a little bit more and testing it in Penn Simulation Center, where we're going to use clinicians, medical scribes, and paid actors to portray real-life clinical scenarios. And this is all part of a strategy to systematically de-risk our proposition with that first validation in the Sim Center, as I mentioned. Then we'll be launching our HIPAA-compliant clinical pilot. And as we grow and refine our tech, we'll continue to increase our defensibility by filing patents and eventually integrating with EMRs.
Building a production version of Quill is going to take a lot of hard work and some capital. We appreciate the opportunity to share our vision with you, and we thank you for your time.